My name's Fiona Cossu. I work for Buds and I've been there for about 3 years. Initially I was doing a mental health nursing degree and I needed some experience, so I went for a placement there. I really enjoyed what I did. I was doing befriending initially in people's homes and then got involved with the groups. After a while, fortunately, a job became available there, and due to my volunteering, I was employed by them. I run 3 groups now actually, and it engages people who are living in the community with dementia. It gives them a chance to come and socialise, receive lunch and have something that's their own. And some people don't get to go out of their homes at all, obviously, and this will be a real lifeline for them. It hopefully keeps their cognitive skills going and socialisation, and therefore stops the dementia setting in quite so quickly. There's a lot involved with running that as well. There's the practical side of lunches, transport, everything like this, all the logistics, and then there's arranging activities and nurturing their needs, monitoring really how they're progressing, and if there's any concerns then following up with that. It's no day's ever the same, that's for sure. Just when you think you've seen it all, working with people with dementia, something else will come and surprise you. But it is really enjoyable. I'd cared for my auntie who'd had really more or less lifelong significant mental health problems. They were multiple and varied. And after she had died, which was quite young, I sort of felt a bit lost from it and a bit detached. I thought I needed to continue doing something along those lines. So looked at the mental health nursing and was just led into this. I never actually completed my degree because I took the job instead. I thought about that for quite some time because obviously to just stop doing a degree was quite a decision, but it just felt like the right thing to do. And I just followed my heart with it, really. I don't think that I would, really out of choice these days. I think if I was going to do something at university now, it would mainly be out of interest rather than career orientated. I feel like I found my footing and I've just trained in alternative therapies as well. So I'm actually a Reiki practitioner as well. So the future may hold something more along those directions, but if I do go back to uni, I think it might actually be something in the arts. Reiki is a form of energy healing. It assists your body's own methods of healing, physically, emotionally. It helps to regulate all your systems, and it works with traditional medicines as well. It's based on the principles that everything contains energy. It does, your heart emits a certain radiation, electricity that you can pick up as a tangible field, and it's channeling your own energy to help smooth other people's, really. You use your hands at various points, what we call the chakras, that are real energy centres on the body, to see if there's any imbalances there or any blockages that are preventing your energy's flow, and hopefully over time help to remove that and help things to heal. It's based on the principle that most traumas or illnesses are caused by events in our life that have caused these energy blockages, which eventually become a physical thing. And your body is telling you this is a problem, and will help to flush that out. I would have to have permission to use the Reiki with the people I work with, because it is a personal thing and it is hands-on, and you wouldn't do it without somebody's consent. I'm hoping to be able to implement it within my work as well, and hopefully offer it as additional service through Buds. I usually just practice private clients at home, but we've seen some really good results. Well, it's proven to have really good results, and in America they are using it as standard with people with dementia, and a lot of hospitals in America now, all health professionals there, doctors and nurses, are actually trained to be able to just help in a different way, really, because it's a tense time when you go into hospital anyway, isn't it? But using the energies and the subtle energy fields, it's like an unspoken communication, and people tend to really respond better to all forms of surgery with this Reiki as well. You have what's called an attunement. You can have it done in various ways, but I chose to go for the 3-day attunement, which is where somebody is trying to a Reiki master level basically reattunes your own energy to be able to channel things better. It is an adjustment, and you do definitely feel that adjustment. I'd had 12 months of therapy first before I felt comfortable to actually have it done. But after having it done, when you're using the Reiki in a treatment, you can actually feel it in your hands or within your body. To give you, the other day I was treating a lady that had come for migraines and things like this, and as you're treating her, I was able to pinpoint really where the migraines were located and arrive, because there's a generalised feeling there. I picked up things in her neck, different things. People feel it different ways, I think, because it's using your energy and theirs as a combination. No two people would really feel the same thing, but on personal experience, I feel it very much physically within my whole body. Some people just feel it in the hands, some people it's just a generalised gut instinct. The best advice that I'd give people who wanted to get involved in any sort of care work or helping others is experience. You cannot replace experience. Even if you've got the college course, degree course, get out there and do some voluntary work. It's more than vital. Just having different experiences with people and seeing things, you cannot replace that. And it can, as it did for me, lead to some really good opportunities. You know, you can have your foot in the door ultimately, but it gives you a sense of like satisfaction to be able to see it in action, you know, and see what you're letting yourself in for. Because to see it on paper is one thing, but to actually see it in person and relate with people, it's very much a personal thing, and you can't replace that experience. I'm unsure at the moment. I'm happy where I am with Buds, and Buds is expanding all the time. I've really enjoyed my time working with people with dementia. It's brought a lot of things on a personal level as well as for my work. It's brought up a lot of questions, because you see some people in real dire straits, and ultimately you think, gosh, that could be me eventually. So it does change your perspective, which again I think helped push me into the therapies as well. I'm hoping to be able to develop my therapies more and have private practice, but just out of choice I think I would still keep at least one day a week going with Buds, just to give something back to them.